This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Hello and welcome to Iking Live. I'm your host, Ike Seneres. Our topic today is holistic and integrative medicine. I think I'll just start by asking Dr. Chat Austria to tell us, what is it, Doc? Holistic and integrative medicine.
Well, holistic medicine is a type of medicine where you use different modalities aside from the usual conventional modalities. And integrative medicine is you use both the conventional and the holistic medicine combined into treating a patient.
Is that a new field, relatively?
Relatively, I would say yes, but it's been like in my practice, I have been doing this integrative medicine for 17 years.
Okay. How many, from what you know, how many doctors are like you in the Philippines?
I think the number is increasing. We have an organization, we formed PCAM, Philippine College for the Advancement in Medicine. That is not both doctors and health practitioners and enthusiasts, all interested in holistic, integrative, some of them natural medicine. And but there are different organizations of who practice the integrative medicine. So to give you the official number,
More or less, 100, 200?
I would think, I would say the ones I would know, maybe 100 or so. But there are some people who just do it, some doctors who just practice it without joining our organization, and they are doing it to certain extent.
Okay.
So it is now becoming more popular. Some just do a little bit of acupuncture, some just include a little bit of nutritional. So
So you're
different
saying
degrees.
100, 200 out of how many doctors in the Philippines?
I
Maybe
don't know.
10,000, 20,000?
I don't know what is the official number in the
More or
Philippines.
less?
The one I told you, 100, 200, these are the active
Yes,
doctors.
but
I'm
the
aware
ones
of.
practicing the traditional would be, say, about 10,000?
Maybe because in Philippine College of Physicians, when they have conventions, they have thousands of who
Oh,
attend.
okay.
PMA, they have, I don't know how many who attend. And in PAMS, they have doctors in all different regions of the country.
So when you say a doctor is already trying out some approaches, how can you tell? Maybe they're prescribing organic food,
They are prescribing about the lifestyle.
okay?
They prescribe nutritional supplements. They encourage detoxification. They use herbs,
Okay. And you mentioned acupuncture.
acupuncture, and
How
other
about
modalities.
yoga?
Yoga could
They
be
would be?
included, yes. They would include other modalities like chelation therapy, ozone therapy, acupuncture, hyperbaric oxygen therapy, different colon hydrotherapy, Um,
Some electric charges.
uh-huh. Uh,
Okay. So, in contrast
Bioxydative
to
medicine, homeopathy,
purely medicine, prescription, what do you call that?
drugs.
Drugs.
Mm-hmm.
So the other side would be purely drugs.
Mm-hmm.
And maybe somewhere in the middle would be a combination of drugs and all those other treatments. And towards here would be those who are
Purely.
not maybe purely, but mostly, I guess, no?
Mm-hmm.
Trying
Yes.
out new ways, no?
Yes.
Interesting. Would you say, Doc, that you are willing to accept patients who have been given up by this side?
Yes, because we have a totally different approach, and maybe the reason why they have not responded. For example, let's talk about chemotherapy.
Mm-hmm.
Chemotherapy kills the cancer cells, but it suppresses the immune system.
Do you have an alternative to chemo?
Our way of approach to treating cancer is to boost the immune system,
Mm-hmm.
and you make the immune system fight the cancer cells.
That makes sense.
So,
Mm-hmm.
if you integrate it, you have the drug destroying the cancer cells. At the same time, you are giving immune boosters in the uh, integrative medicine or holistic medicine, so that despite the chemo, the immune system does not
Okay.
suffer,
Uh-huh.
and the patient has more strength to continue with the treatment. For example, natural killer cells, and that has been natural killer cells or the macrophages, your immune system fight the cancer cells. But if you give the chemo, you suppress all of these things, or immunosuppressants.
So there will be a balance.
But if you try to boost the immune system, you may opt to give less chemo, which will have less side effects, and in effect, you might come out with a better chance for the patient, because you are killing the cancer cells at a dose that is not so detrimental to the patient, and then you are boosting the immune system.
Do you have some experience wherein you were able to turn around cases of cancer patients?
Well, yes, I had patients that I've treated with, when you say turnaround from a certain stage,
I'm very careful with my words. I don't want to say that you have this miraculous cure. Maybe you have a methodology that will improve their condition, or
we have a lot of methodologies. We have improved their conditions.
Mhm.
And then, because we see cancer patients in different stages.
Okay.
We see cancer patients who had post-surgery, who do not want.
You still accept up to what, stage 4? You still accept?
We still accept stage 4.
So you still hope that something can be done for them?
Yes, because we say, in the humanistic sense, you never give up until the patient is gone. And the worst that you can do is make her more comfortable, make her suffer less, have less pain, and increase energy and better quality of life. Maybe in the end, you may not have succeeded 100%, but you have in cancer, they don't talk about cure rates. They talk about survival rate. Do you have a 5-year survival rate? You have a 10-year survival rate. So in integrative holistic medicine, you can say you prolonged her life 5 more years or 10 more years.
That's good enough.
See, I've had a patient, the cancer came back after 15 years.
And
We treated her. She was my patient for several years, so many years. And because of financial reasons, she dropped out for 1 year. And when she came back, she was in a worse state, so we were catching up. But I've had patients stage 4, and we would take care of her. I have one patient. She was my patient for 8 years.
fantastic. You have a very realistic outlook. Yeah, you're right. It's not about an ultimate cure. It's all about management. No? Prolonging the life, not only prolonging, but making it quality.
And talking about cancer, we are all walking around with cancer cells.
All of us.
Yes. It's just that your immune system is the surveillance system keeping these cancer cells checked.
Mm-hmm.
So you don't tip the balance that you have more cancer cells than you have more healthy cells.
Mm-hmm.
So you just, even if you're walking around with cancer, but you are in the positive balance that you are able to handle these cancer cells, and you know, you can have a mass for 10 years and still stay alive.
Okay. It depends on how your doctor would manage.
Mhm. If you are able to help the patient fight the cancer cells but not totally eradicate it, it is under like controlled cancer.
Yeah, so this is like mathematics.
You have a 1
You are,
centimeter
you are
node.
not curing it, but it's also not progressing.
Mhm.
No plus, no minus.
Sometimes it regresses, sometimes it stays the same, sometimes it
Uh-huh.
disappears.
Oh,
Oh, sometimes
So-
it disappears. I mean, we've seen that a few times. You have a mass, it disappears, but then there's another mass that comes out somewhere else, smaller.
mhm.
You know, the body is, you cannot predict what the body will do. Sometimes.
Would you be willing to say that there is hope for every cancer patient?
Yes, because, yes, I would say there's a hope.
Uh-huh.
And, you know, it's like you prolong your life and you live as comfortably as you can without suffering.
Mm-hmm.
You know, my father used to say, as a doctor, he was a dean of College of Medicine, and
The first dean of the UP College of Medicine?
he was the first chief resident of medicine in UP, PGH,
Okay.
but he was the first chairman of the Department of Medicine in UERM and the first president of the Philippine College of Physicians. But he would always say, to cure sometimes, to comfort always. That I can
Good
remember.
balance.
That I could always remember what he said in terms of medicine. Because you are never sure whether you could always cure, but he said, to comfort always. So what you do is to decrease the suffering of the patient as much as possible and hope for the best.
It's just like my view of poverty reduction and poverty alleviation.
Yes.
You cannot reduce it right away. In the meantime, you can alleviate. Excellent. Well, how do people go to you, Doc?
Well, by word of mouth, but now more and more, I think the patients are getting tired of taking so many drugs, and a lot of times now it's because they're looking for a natural. That is, I think, the word they use, for a natural doctor.
And you can give it to them.
And somehow my name pops up.
How about children, Doc?
We treat.
I hear cancer cases are getting younger.
I know it's getting younger. I had a 7-year-old cancer patient.
Is that so?
Yes.
Why?
She was from Ilocos, and she lived right beside the eggplant plantation,
And?
full of pesticides.
Oh. Cancer? What about mercury? Does it cause cancer?
It is a carcinogen, yes. There are some heavy metals, a lot of them are classified as carcinogens. You have the mercury, lead, cadmium, nickel,
So what's happening now? As I understand it, most cancer patients go towards traditional medicine, and many of them end up with chemotherapy. That's how it is now.
Okay.
What's the problem? Not too many people know about alternative or holistic integrative medicine.
Well, yes, because it's also they're scared because they are always concerned, can you cure us? And we cannot claim. So,
Well, yes, I was gonna say that. Well, the credibility of your father adds to your own credibility, of course. And of course, it helps to mention that you are a real MD and you're from UP. So you're not kidding. You know, you're you're for real. And I think the mind of the patient is, where do I go
Yes.
so I can save my life? Do I go
Yes.
to this traditional doctor and bet on chemo, or should I go to holistic medicine and risk my life?
Well, see, that's why the patient, you know, you know what doctor means? The doctor is a teacher. And for the patient, the intelligent patient, they should study their case very well and educate themselves so they can make more intelligent approach.
Are we expecting the patient to make intelligent decisions?
Well, so that they can decide on, well, can I combine? Could I just go one way blindly, or try this thing? Is this going to be? Because for me, in my clinic, I spend 1.5 hours sometimes if I don't have another patient next to this
I
patient.
noticed that, yes.
Even 2 hours with one patient. Just trying to educate her about her disease. Yes, her disease.
What about the family? Are they part of the decision making now?
It all depends on the family. In the Philippines, a lot
Yes,
of times, yes.
Okay.
I had a patient who was stage 4 cancer patient. He was my patient for 6 months at least. Cancer of the liver. All the time, he did not even know he had liver cancer because the family
family.
did not want him to know.
Wow. And you think it's best if he knows?
It all depends on the patient. Because it depends on the personality of the patient, I think. There are patients, if they know, they become more focused and goal-oriented to get rid of their
Okay.
disease.
We only have 5 more minutes. I have a few more questions to ask. Are you affiliated with any hospital?
No, I am not affiliated with any hospital. Originally, when I came back from the US, I was planning to do that. But then I got so busy with my practice and the lifestyle of doing hospital rounds, I know that very much. It's not very enticing, you know. I did hospital rounds with my father as a student because we always waited for him after school in his clinic, and we would go from one hospital to another before we get home, which will take us 2 to 3 hours, and go house call. And
You've had enough of that.
his driver used to say he was more popular than Nora Honor because going all over Metro Manila.
But does it not affect your credibility if you are not affiliated with the hospital?
Well, because you can work with a doctor in the hospital.
I see.
You don't have to be the attending doctor.
I see. So, do you have enough cases now or
For
cancer?
I have several. Yes, I don't know what is enough. My practice, because my training was in internal medicine, was at Framingham Union Hospital. A bulk of my patients are cardiac.
Oh.
I used to see so many heart attacks, 3 or 4 heart attacks a day.
Could you call yourself a heart doctor? A cardiologist?
I would say in terms of my training, we did balloon counter pulsation. We used to convert, atrial fib to sinus, with cardioversion. We always did all those. We were sometimes help the cardiologist put the catheter in doing this cardiac cath.
So your background with cardiac somehow helps you with your focus now, which is more of...
Yes, I at least see, because with the cardiac, that is the beauty of integrative medicine. You use conventional medicine when you have to, and you use integrative holistic medicine, which I think is helpful, better in terms of maintenance. Emergency, you use conventional. That is the forte of the conventional
Aside
medicine.
from heart, you could treat
Stroke,
diabetic
diabetes.
patients, liver, kidney.
In diabetes, I think holistic medicine is very good because diabetes is a matter of educating the patient how to prevent all the complications.
Education.
If they know, you can guide them, and then they know how to control. They are more focused, and they have a goal of how to prevent the complications,
Going
not
back-
just measuring blood sugar.
Going back to the children now, if they could be educated earlier into eating the right foods, and living the right lifestyle.
The children now, no matter what country, they are getting heart attacks in their 20s,
Because of junk
30s,
food.
like lifestyle and junk food and the food. Any country, I know the youngest I've heard is 15 years old in this country, had a heart attack.
Wow, that's news.
From the director of Hypertension Institute in Tennessee, I think diabetic and metabolic syndrome and hypertensive also in the teens.
So maybe we could end this segment by saying it's what we eat. And maybe
A lot of it is, yes,
Uh-huh.
influenced with what we eat, especially diabetes and cardiovascular, this whole metabolic
Okay.
syndrome thing.
And what you're saying is if we get sick because of what we eat, we might possibly get well because of what we eat also.
And do you know what's not good about conventional medicine? There is no subject of nutrition. I wanted to take a nutrition elective and there was no.
Can't they just call in a nutritionist for that?
They will teach you calorie counting, but what do the nutrients do? No.
I think you have to come back here for another.
And I taught biochemistry. I thought I would know what the nutrients are doing, but it was not enough.
Doc, come back here. Let's talk about nutrition. What
Because
you
why
eat.
is it not in the medical curriculum?
I want to hear the answer to that.
I do not know. Maybe we should ask them.
Okay. Meanwhile, thank you for coming, Doc.
Thank you, Ike, for
And
inviting me.
take it away, baby. Tayo na natin yan.